Your sexual function, your hard health in terms of penis health, 100% depends on your lifestyle. Exercise and nutrition are going to be the key things that are going to help sustain sexual function in the future. And if you establish those routines, those healthy habits in the very beginning, you're going to set yourself up for a very healthy life. It started 13 years ago. So happened to fall into my lap, no pun intended there, but certainly welcomed. A friend had brought my attention to pelvic therapy generally, and at that time it was women's health. I shadowed a pelvic floor therapist, fell in love with it, and then decided to pursue my continuing education in pelvic health. Now, at the time, it was women, very female centric,
Yeah.
gynocentric, I should say. And when I opened up my practice in 2012, that was in Illinois at the time, it was very generic and men were reaching out to me asking for help. They saw on my website that I treated bowel, bladder, sexual functions, pain, and they're like, I have similar concerns, can you help me? And so it was really through the courage of these men and their willingness to ask for help and come into my clinic where I learned from them. I was able to support them through their own process of opening up and their willingness for me to learn, because there was certainly no curriculum for men's health at that time. Certainly that landscape has changed currently. And there is still a gap, unfortunately. However, it's getting better. And so that's how it all started. I was like, there's a void here. I need to help these guys. How can I do that? And so I stepped into this advocacy for men's health ever since then.
Amazing. Now, I'm going to be honest with you. I just started hearing about women's pelvic floor physical therapy a few years ago, and I didn't even really realize that this was something that men needed as well. So, could you tell us real quick a few things that men come in for commonly? You mentioned a few in your origin story, but what are some common things that men might seek pelvic floor physical therapy for?
Yeah, so let's start. So bladder, bowel, and sexual function. Some examples under bladder include urinary incontinence, and that could be due to prostatectomy surgery or any type of cancer treatment sequelae, but that can also be related to urinary urgency or frequency, benign prostatic hypertrophy, medication-induced incontinence, and just general deconditioning of the pelvic floor that might lead to something like post-void dribbling. Then you also have bladder or bowel dysfunction, and bowel dysfunction can be constipation, pain, difficulty having a bowel movement, or keeping everything in. So we deal with incontinence, that could be a thing as well. And certainly, again, sequelae, treatment sequelae of colon cancer, anal cancer. And then we have sexual function, so erectile dysfunction, ejaculatory disorders, sexual pain, and really any type of pelvic pain in this region. It could be genital pain, it could be pelvic floor pain, it could be pain with functional activities such as pooping, peeing, or sex. So those are some of the general things that we work with in men's pelvic therapy.
Yeah, fascinating. Is that something that men seek out like just as they get older, or is there usually like some underlying cause, like you had mentioned, cancer or surgery?
It's just pain in general. Folks might have insidious onset of pelvic pain, genital pain that comes out of nowhere. It could be triggered from an injury. It could be an athletic injury. It could be a sexual injury, but they're having some sort of distress in their pelvis that is not able to be explained by urological tests are negative for infection. There isn't any red flags that are popping up. And so chronic pelvic pain syndrome falls into this umbrella of having any type of pain related to bladder, bowel, or sexual function that is causing significant distress and limited function. And function also includes pooping, peeing, and sex in that situation. So it could be just pain. It could be due to age-related changes, such as urinary function changes or sexual function changes, certainly. But those are just some of the outlets as far as people seeking care. And it does take men in general, and when I say men, people who have penis, to ask for help because it is so stigmatized as far as the conversations around pooping, peeing, and sex. And
Yeah.
it's exceptionally challenging for anyone with a pelvis. But because of social cultural scripts that we live in, it's exceptionally challenging for men to reach out and ask for help.
Yeah, absolutely. Now, I want to know what is one trend in this industry or in men's health in general that genuinely excites you?
So the trend that generally is exciting me at the moment is the access and availability of practitioners in my field as a pelvic therapist, but of all genders. So we're talking male practitioners, female practitioners, and gender inclusive practitioners who are opening their doors to people who have penis. And so they're feeling more comfortable and more confident in working with people who have penis, which is certainly a different landscape than when I first started my passion in pelvic therapy. So I'm really excited that there's greater accessibility and availability for men to seek care for their bowel, bladder, and sexual health concerns.
Oh, absolutely. That is an exciting trend. I love it. All right, now if you could teach the world one key insight about this field, something that really moves the needle, what would it be?
So, one key insight that I would like to share with the world that's going to move the needle is to let people know that yes, men do have pelvic floors too. That penis havers have pelvic floors. And so I have a model here, you can see here, that is male centric here. Everything in between the butt bones is muscle. So, same muscles, same vasculature, and also erectile tissue that are similar in people who have vulva. They're just organized differently. So you do have a pelvic floor and it functions in a very similar way. Pooping, peeing, and support are very important aspects of the pelvic floor. And so we need to start to recognize that things can go negatively in this area, but there's hope and there's help to address these concerns from urology to nutrition to pelvic therapy.
Oh, I love it. And I love that you came with a prop. That is
Oh,
fantastic.
always do.
I love a good visual. What is the most important thing professionals need to know about men's pelvic therapy in this space?
Pelvic floor therapy includes the pelvic region. And I think it's important for health professionals to understand that we as musculoskeletal experts not only are treating the muscle aspect of things, but we're also addressing the nervous system health. And we're also very much psychologically informed to address, trauma sensitive topics and situations because we are a licensed profession that has the privilege and certainly the honor to touch people's bodies. And we're also touching very intimate spaces of their bodies. So we are trained to be very sensitive in addressing the whole person, not just looking at their body as a body part, but we're looking at from the perspective of function, and we're looking from the perspective of what are the things in your life that this issue is really impacting. And then our role as professionals here is to help bridge that gap for them and to help people feel independent, get a sense of agency and self-efficacy for feeling more in control of what's going on and really enhancing their confidence in their body. So whether that's urinary function or bowel function or sexual function, we're the care providers that are going to help kind of bridge the connection between all of those from a brain body perspective.
Yeah, definitely. And so you are a certified sexuality counselor and educator. So do you think it's important for pelvic floor physical therapists to receive that additional like sexuality education and counselor experience and
Yeah.
knowledge?
100%. Because here's what I see in my practice sometimes is that, for whatever reason, there are folks that have a certain level of comfort and confidence in working with people who have penis. And I should note that a majority of the physical therapy profession, at least last I checked, and especially when we're talking about pelvic health, are female identified or female centric.
Hmm.
And so we're talking about a provider who might be a different gender than a person who has a penis. And so there's that context and nuance in that conversation. But there's also the education and comfort around being able to confidently work with someone who has a penis. And so I often see and hear through the people that I do work with, the men that I work with, is that a lot of providers shy away from addressing the genital. So they might have a sexual pain like erect pain, pain with ejaculation, pain in the glands, pain in the scrotum. And those genitals are often moved aside or cup your hands over your genitals. And that is a huge disservice, I think, to men, because we're trying to validate and affirm their experiences and also have a
Yeah.
practitioner can say, hey, look, this is the part that hurts. And when we know that a practitioner can create that therapeutic container, that trust, so that that person can genuinely open up into that space is really important as far as the therapeutic process. And that in and of itself is therapy, in my opinion. But not only that, but having the conversations around, you know,
Yeah.
in the profession of pelvic therapy, unless you've had that additional coursework, such as the xuality certification, it's not something that is included in general male pelvic floor curriculum. Like, how do you do a sexual health intake? How do you talk about masturbation or certain sexual behaviors? Again, all related to their concerns, but very, very much so needs to be a conversation had within that therapeutic space. So yes, I do believe strongly that getting additional skill and knowledge as far as sexuality counseling or education and being able to have set and structure and framework to include these conversations with people who have penises is super important to the therapeutic process. And has been a game changer for me in my profession and career, no doubt.
Oh, absolutely. I cannot agree more with you. That's amazing. All right, my last question for you. If you could leave one message for the next generation about men's health, what would it be and why does it matter right now?
So my next gem for the next generation is please, please, please exercise. So here's what I mean by that. Your sexual function, your hard health in terms of penis health, 100% depends on your lifestyle. Exercise and nutrition are going to be the key things that are going to help sustain sexual function in the future. And if you establish those routines, those healthy habits in the very beginning, you're going to set yourself up for a very healthy life.
I love it. What better reason to exercise than I mean, that's motivation.
100%. It is the key prescription, to be honest, in order to help enhance and optimize sexual function. And when you start these habits early on, it's a lot easier to make them part of your life and a priority because there's far greater benefits. And it's not just your life, but it's also your cardiovascular system, your musculoskeletal system, staying strong, reducing fragility and frailty and osteoporosis. I mean, there's nothing wrong with getting strong, and we gotta establish these health habits early on.
Oh, yeah, absolutely. So, just a quick follow-up. Someone's watching this and they're like, okay, exercise. Should I just be like going on walks? Should I be doing some kind of like strength training? Like, what kind of exercise specifically?
Yeah, the general guidelines around exercise for adults includes 2 to 3 days of resisted training. So working all major muscle groups 2 to 3 days a week. And then 3 to 4 days a week, we want to have some cardiovascular, so 20 to 30 minutes or so of moderate to vigorous cardiovascular exercise. So that could be running, that could be brisk walking, that could be swimming, anything that makes your heart work harder and your muscles work harder than they normally do. Now, certainly for some people, this might sound, oh my gosh, like I don't know if I can, that's where I start. That seems overwhelming. Something is better than nothing, y'all. And if we start small, baby steps, right? Do what you can and build up and work from there. Again, something is better than nothing. So I'm always encouraging people to start where they're at and then build appropriately. And if you're looking for guidance, definitely seek help from a personal trainer, a physical therapist, an exercise physiologist, someone that can help tailor a program to you and your needs safely.
Amazing. What a great pro tip. All right. Well, thanks so much for being with us today. We appreciate your time.
Thank you so much for having me.